situations happened 100 times. I'm at a party, a social gathering. You're meeting people for the first time. They learn I'm a chiropractor, and they're like, oh, that's really cool. I haven't needed one yet. I'm good. And then there's other people that I've been going to one for years. I feel amazing. This is how my life used to be. This is how my life improved. And then the guy or girl who says, well, I haven't needed one yet, is a little confused. Because their understanding was when I say, well, what does that mean you haven't needed one yet? And it's, you can answer this for me. It's because they haven't been in pain. So they feel like they haven't needed chiropractic care because they're not in pain, right? So when you study and you become a doctor and you look at research and you look at studies and you see how the body functions and the integrity of the nervous system and what it does. And, when you learn, only 6 to 8% of the nervous system is there to feel pain. The nervous system is there for you to adapt to its environment, to be healthy, structurally clear, to adapt your chemicals to stressors that are happening in your life. This is the job of the nervous system. And when you start learning that as stress builds up in life from the day you're born, it's how much can your body adapt until an actual symptom starts showing up. And you'll hear me talk about this all the time in past videos that we've done. It's all about adaptation and how much can you adapt until your body starts breaking down. And how does our body talk to us? Is through signs and symptoms, right? When you study to be a doctor, you're just there to listen to the patient and educate them. That's what doctor means. And you're either going to treat them, which means you're going to give them something to numb down or shut down the symptom, or we want to educate them to understand their body more, understand their stressors and what brought it on and how can they help their body to adapt better. And understanding the neurology and how the body works, and the term subluxation is when a bone is out of place and it puts pressure on the nervous system and it cuts down the integrity of communication from brain to tissue cell, and then the body can't adapt anymore. So you'll always hear me talk about the atlas. How's your atlas? And I know that if every family understood the integrity of the atlas, they'd have their entire family getting their atlas checked on a regular basis by a chiropractor. So what does it mean that to go get checked by a chiropractor for the sake of just making sure you're not subluxated, that you don't have nerve interference, that your brain and body are functioning to their fullest potential? That's the way it should be. That's where people should be educated. And we look at the research, and, chiropractic's been around over 125 years. Millions of human beings have been adjusted and had their life changed by chiropractic. To me, that's the coolest thing, is you could talk to the people and what kind of results did they get? How are their families healthier? How has their expression of life changed? Because there's the what if my child did not go, right? Because how many kids are truly in pain? And we see it more and more because kids are sedentary. But how many kids are truly in pain but are subluxated? That's the better question. And we have kids coming in with all kinds of symptoms. They start getting adjusted and their symptoms go away and their expression of life gets better. That's the major, major thing. So that's what we want to look at, is chiropractic is not truly about pain. Yeah, it helps, right? If more people went to the chiropractor on a regular basis, they would not rely on opioids, right? That alone could change the entire world. But when we look at the kind of patients we see at our office, and all my colleagues are seeing all around the world, and the results they're getting, and we could speak the truth to the people to say, it just makes sense not to walk around subluxated. It makes sense to have your nervous system functioning as fully as possible. And we're showing the research out there, and we're showing the information through Dr. McCoy's work with vertebralsubluxationresearch.com. It's amazing stuff. And our Instagram pages, we're sharing all this at Dr. Steve Judson. Go check it out. Share it with your friends. I share my own story in Wake Up Humans, the book. Okay? Order the book on Amazon and check it out, and you'll see. I mean, I've got people every day coming in the office now. I read your book. It blew me away. I was in tears. I was happy. I get it. I want to be here now. They're bringing their kids in. I want my kids here now. They understand what this all means. And that's what people need to understand, is to get checked for the sake of getting checked. Just make sure you're simply not subluxated so your body can function to its fullest potential. You got it? So it's not about pain, people. Pain is a part of the aspect, but pain is good. It's your body talking to you. But it's about your expression of life. And life is better when you're not subluxated. How's your atlas?